This one. Thank you very much. Okay, this is what I'm going to be talking about. Giving you some background information on deafness, because not everyone has had contact with anyone from the deaf population or knows much about deafness. I'm going to take a brief historical perspective on this topic. I'm going to look at the prevalence and the symptoms, something that's called information deprivation, and managing trauma, diagnosis and treatment, and a few quite heavy conclusions. Just a health warning. This is not a talk that you're going to get cheerful from. It is portraying a very crucial and difficult situation. And so just be warned. Okay. So if you investigate the literature on trauma involving deaf people, language and communication is absolutely dominant as a topic. But most of the people who have done this research are actually medical people, so they're not linguists. The relationship between language and trauma is complex, and as I said, most medical research has been done in the USA by medical staff. Oh, sorry. And so almost no linguistic studies have been done. I'm not going to name pieces of research in the slides for the benefit of the interpreters, and I'm getting a nice grin from because this is complicated for interpreters. If you are really interested in getting the references, I will send you a copy of the paper, just mail me. So in deafness, the age of onset of deafness varies actually tremendously from pre-linguistic hearing loss. That means before a child actually even can learn a language of any, to loss in older years. So the whole range is there. This age of onset is quite crucial. The younger the child, the more chance there is that the child will learn both sign language and a spoken language. The older people get, the chances of them learning a sign language become much reduced. 2 to 3 children per 1,000 across the world are prelingually deaf, although their figures are not there for many countries. It's 6 to 7 in South Africa, having to do with healthcare and non-awareness of genetic influences on deafness. Most prelingually deaf children, that is, children more or less deaf from birth, are born into hearing families, certainly above 90%. So this is quite a critical language learning position for deaf children. And educational achievement varies also a lot. Less than 15% of deaf young people achieve a reading age of 12 years. And we're talking worldwide here, world research. So this is the situation for deaf people. Taking a bit of a historical perspective, discrimination against deaf people is an age-old phenomenon. Where rights were withdrawn in certain communities for deaf people, they were not considered full members of a community. And of course, you get the use of the term deaf and dumb, which deaf people are not dumb. And dumb also in English has the additional connotation of being stupid. So these are correct anyone you meet who uses these terms. Right. Oh, here we go again. It's going, yes, okay. The disability perspective, so seeing deafness as a disability, ignores the existence of the cultural group deaf, written with a capital D. And the disability perspective is what is very common amongst the medical profession. And of course, just as a note, the most horrific persecution of deaf people occurred in the Nazi regime in World War II. Okay. Postlingual deafness, meaning becoming deaf after the age of 4, 5. Okay. Sudden hearing loss can actually be a trauma in itself. And anxiety and depression is much higher in this group than in people with hearing unaffected. A study of military veterans found that with bilateral hearing loss, so in both ears, it's a 3 times greater chance of having post-traumatic stress disorder than when it's only hearing loss in one ear. So this shows you the dramatic effects of hearing loss. And the restrictions on using a spoken language often used to a loss of a profession. Can I carry on doing my job? Often not. Difficulties in close relationships because of the communication difficulties. Feeling uncomfortable in gatherings of hearing people. And this can lead to social isolation and a negative self-image. And the quotes, which will always be in blue, these are actually quotes from affected individuals. I'm just not such a nice person anymore. Okay, so really a pretty dramatic effect. This is a case study. Eric, his hearing loss is progressive, and within a few years he would become completely deaf. And he gets this diagnosis, and it hit him really hard. He had many doubts about his future. Will he be able to carry on with his job? He was working as a communication advisor. And the symptoms that he had as a result of this diagnosis, he started experiencing frequent flashbacks of many hospital treatments he'd had as a child. He sees images of himself being held down by doctors and nursing staff, and medical procedures such as injection needles and anesthetic mask. And because of the communication difficulties he even had then with some hearing loss, things were not explained to him. Okay. And these images actually wake him up in the night. Okay, prelingual deafness, so deafness at birth or very soon after. Okay. There's an American study using what's called the Life Events Checklist. This is a checklist which is used to actually diagnose whether there is PTSD. And this study was one of the very few which was used with signing adults. And what they found that the most common traumas resulting in PTSD have the same causes as in the hearing population, so emotional abuse and poverty. So these are the two that are pretty high on the list. However, there are specific traumas for this population. So witnessing parental grief at the time of diagnosis. The child experiences themselves as being very the cause of this parental grief. And this can be a traumatic experience for a young child. Lack of communication in the family. No communication access at the hospital or doctor's surgeries. Being sent to a residential school early. No communication access at school, and punishment for using signing at school. From this case study, Maria, she says, well, she signed actually, my parents dropped me off at the deaf residential school when I was 3 years old. They didn't sign, I didn't speak. We had no shared communication. So I had no idea where I was. When I left, I was inconsolable. I was terrified I would never see them again. I next saw them for winter break a few months later, but it was too late. For most of my life, I continued to blame my mother for that experience. This is another case study, Fatima. She's 18, lives in a hearing family. The spoken languages are Berber, that is a language spoken in North Africa, and Dutch. The family does not sign. She's often kept home at school and is given the household chores to do. If she doesn't understand the chore she has to carry out or doesn't do anything that she's told, she's considered rebellious. She is locked up in her room and beaten by her father. Okay. This, of course, is a traumatic experience. The fact that she's being kept home from school, the deaf school where she wants to be, she wants to learn, and the treatment that she's getting at home. In this population of people who are prelingually deaf, they are more vulnerable to neglect and emotional, physical, and sexual abuse. The figures are actually quite terrible. Study in the US, 50% of deaf girls had been sexually abused compared to 25% of hearing girls. 54% of deaf boys compared to 10% of hearing boys. In the Philippines, it was even higher, 60 to 70% had been sexually abused. The hypothesis is that the communication difficulties are at the heart of this problem because the deaf person is seen as weak. They're less likely to report the incident because of the communication problems, and therefore they are a target. Okay. Deaf kids, this is a Steve Crump, who is actually quite famous online. He lost his hearing at the age of 17. He struggled with communication, but he founded this organization, Deaf Kids, as an international agency for the protection of deaf children. And he writes here, I had the chance to raise the challenges being faced by deaf children. The chief executive officer told him about a case in sub-Saharan Africa where deaf children in schools were being abused and raped by militias. They had no way to tell anyone what had happened to them because no one in their surrounding could sign. And what do we do about this? This officer asked Steve, when we have no way of communicating with these children and they have no way of communicating with us. Now you can see how central communication is in this situation. Okay, in prelingually deaf individuals, the trauma symptoms are stronger. So there's depression, anger, and substance abuse. These are all related to trauma. Unique trauma symptoms are higher levels of dissociation, that is amnesia and identity alteration. So amnesia, you forget what has happened, you don't deal with it, and identity alteration. And this could be related to early social deprivation and communication difficulties. Information deprivation trauma. This term was actually invented on the basis of an American study because information is not available to deaf individuals or it's not provided. What do I mean? For example, earthquake warnings. If you're living in California, the earthquake warning is an auditory warning on the radio, on the streets. It's not heard and it's not understood what is happening. You can imagine being in that situation, something is going on and you have no idea. Okay, family events are not communicated to the deaf child or adult, often out of a feeling we'll protect them, we won't tell. But finding out later leads to distrust. Lack of knowledge of what is normal is also often missing. So physical contact in medical situations can be confusing, as I kind of edged on before, because it's not explained, right? Physical abuse and rape is not understood. You could maybe think, how could that be? But one trauma person said, I did not know that this was not normal. being in an abusive marital relationship. Considered it was normal. The case study of Jimmy, age 10, he lives in a hearing family. He's deaf, obviously. He experiences violent arguments between the parents and also experiences violence, but he doesn't understand what is happening. And one morning he gets up and he finds the house totally in chaos and there's blood on the floor and his mother is not there, apparently taken off to hospital. He often relives this experience and he has concentration problems at school and so on. It is affecting him. It is an absolute trauma, which probably could have been a trauma anyway, but if he had known, it would have given him a framework to, understanding about why the arguments were happening and so on. Okay, managing trauma. How do individuals cope with this? Research has shown that self-esteem and a strong sense of identity support individuals dealing with trauma. Children with hearing loss are vulnerable here. It is known that their feelings of self-esteem and sense of identity can be vulnerable because there can be prejudice from the hearing population. But studies have shown that deaf children with deaf parents, where communication is happening in a sign language right from the beginning, do not show this vulnerability to the same extent. So the good communication between parents and children is so important here, also for the sense of identity. Deaf adults who have a marginal identity, that is not identifying clearly with the deaf community, have the lowest levels of well-being in a worldwide study. Okay. In terms of diagnosis, there is, as you probably can imagine, a lack of diagnostic instruments using a sign language. And there's linguistic research on hearing people using a spoken language has found frequent use of specific words used as a diagnostic with hearing patients. But no research has been done on that for any sign language or with deaf people. So we just do not know if there are particular signs which will indicate that trauma has taken place. And lack of information about trauma and such experiences itself impairs the recognition of the symptoms by the patient. So actually recognizing that what you're going through is not normal. In an American study, only 63% of trauma victims actually sought help from formal sources, so trauma units or places in a hospital. And there was also a barrier to seeking informal help, which is actually quite common even with hearing people, that is shame. But this has happened to you. Communication is the greatest barrier. And here a quote from a study in the US. I needed a leader in ASL, an American Sign Language, but there was no model. I needed someone like me to show up, someone who had lived it, to recognize it quickly, but there was no one. Okay. So it's not just communication, it's also having shared experiences. Lack of communication with medical practitioners. Dutch study done in 2019 of medical services. No interpreters were used in the sessions between a deaf patient and the medicals. No interpreters. You think, how on earth? 50% of the deaf patients thought the communication was okay, which is surprisingly high. 90% of the practitioners thought they could communicate the diagnosis and treatment well. Aha, sorry. 83% of the practitioners had never heard of deaf culture. Can be the case that the language skills of the deaf patient can be difficult either in a sign language or a spoken language. This is something, of course, that the practitioner has to be aware of, and also the interpreting services. But as we've seen, these are hardly ever in place anyway. Okay, the recommendations from many studies. The need to work with a provider, so a medical service, familiar with deaf culture, deaf history, and the experiences of the deaf community. Okay. First, there needs to be the awareness that this is necessary. The clinic staff should have basic signing skills and have had training in deaf awareness. The information gap needs to be addressed, so education about trauma and treatment resources, this needs to be available, but it needs to be available in the sign language. Because put everything in written language, you are not reaching your target group. And there's an issue of confidentiality. We talked about shame as a reason for people not seeking help. The deaf community in any area is relatively small. And it's therefore necessary to think of some way creatively for protecting people's confidentiality. And even in a large country like South Africa, you've got small communities. So this is actually quite a big barrier. So conclusions. Well, the impact of trauma on a person with hearing loss is not widely known or understood, and this was a big motivation for me to actually go through all the papers that are out there and to write this chapter. The prevalence is not socially dealt with, so it is known that children in residential schools are vulnerable. What is going on? And I worked together on this paper with Dutch colleagues working in a centre with deaf patients, psychologists and psychiatrists, and they told me the story of the teaching staff at a particular school. Their signing skills were so poor, they were not able to experience what was going on even amongst the children themselves, bullying each other and so on and so forth. They had no idea. This is quite a complex, and the prevalence is not, in that aspect, also socially dealt with. And the provision of services with good communication possibilities is woeful. I could use stronger words, I won't, but it is absolutely appalling. So I said you weren't going to be cheered up by this talk, and I know that you're not, but everyone has you now have some information. You can pass this information on. I don't know if those of you within linguistics who have done sign language modules, you will know that in conversations with your friend in the cafe, they will say, well, isn't there one universal sign language? Oh, how stupid. Or, no awareness. You can be a transfer body of awareness. I know you can't reach medical services, but it is important, for example, that the deaf organisations in South Africa have this information and start to work for it, the deaf people themselves. So that was it, folks. So thank you very much, everyone, for being here.